Well, let's jump straight into it. There's a lot of questions. How would you describe the state of the GHA at the moment, and what will you be hoping to achieve through this overhaul?
Well, obviously, it's day one and I'm not in post until January. I have to say I've been here for the last 6 months, as you will be aware, working in mental health. And I'm really impressed with the changes we've made in mental health and the type of staff we have. And I think people often read about the negative stuff that happens in healthcare, but you've got some excellent nurses, doctors, porters, cleaners here. And I think what we need to do is reach out, work with them, and actually bring in the changes, which they will be telling us what's wrong with the service. Because I'm a great believer, not from the top down, it's the bottom up.
Well, as you say, you've been here for 6 months, so although it is early days, you must have a few ideas of what kind of changes you'd like to be. What would you say might be some of your first steps when you step into the role in January?
I think one of my first steps is actually go out and get the confidence of our staff. I think.
And how do you intend to do that?
By actually meeting our staff. I'm someone who doesn't sit behind a desk. I'm someone who actually walks the floors. And I think because I am a clinician, I understand some of the pressures that they are under. So my whole approach will be engagement with our staff, but also with the public. And I'm a great believer in talking with the public and listen to the good and the bad and the things that upset the public. Because I think if you actually marry what the public are saying, what the staff are saying, you can come up then with a recipe to say, well, this is how we respond. We mightn't agree, we may disagree at times, but that's healthy.
Well, looking at some of the criticism you might have received in the UK from the late MP David Annis, one of the criticisms levelled by Mr Annis was the number of locum staff employed by the service that you headed. The GHA, as you know, has recently come under some criticism for the employment of locums in the gynaecology department. What reassurances can you provide that you'll be advising the GHA not to be dependent on locums going forward and to employ staff on a longer-term basis where possible?
I think every organisation wants to have their own staff, despite, you know, every effort. Some organisations have to get people into help at times. At the end of the day, it's most important we provide safe services to the public. And just like in the UK, we try and train our nurses, our doctors, we try to retain them, but people move on. So my whole approach here will be actually, how can we make it attractive that people want to come and actually work here and actually stay in Gibraltar? How can we train our own people here in Gibraltar who want to become doctors and nurses? Many of them are already abroad. How do we attract them to come back to us? But you can't exclude that you need sometimes locums to actually step in. People go off sick. People have to unexpectedly happen to their family. At the end of the day, we have to provide a service. That's the most important thing.
OK, well, a key criticism of the GHA has been the lack of a higher body, such as the Care Quality Commission, to oversee standards. A subcommittee for quality of care is part of the reform plan that you're part of, that seven-phase approach. Given that it falls under the GHA board, that subcommittee, do you feel this will be sufficiently independent and effective as a mechanism by which to maintain oversight over the GHA?
I think yes. I mean, obviously, the GHA is refreshing itself, as you know. We're bringing in a whole new team of non-executives and executives. And don't forget the non-executives will be local people from Gibraltar who will be monitoring what we're actually doing. I think we need to look at regulation, how we're going to regulate our care, how we're going to performance manage our services, and how do we put processes in place to make sure that what we're doing is right. So it's early days, but it's something we will be looking at.
I'm sure everyone will be keeping a keen eye on
I'm
those
sure
moves
they
then.
will.
All right, thank you for joining us, Professor Geoghegan, speaking to us on his appointment as Interim Director General of the GHA.